This is Week 10, Cancer Genetics and Genomics, Part 1.
The learning objectives are to discuss genetic test technology for cancer genetics, to review the types of chromosomal abnormalities seen in hematologic disorders, and to discuss the current technology utilized in genetic testing for inherited breast cancer in individuals and families. Historically, there's more than 100 types of cancer that have been classified according to cell type, tissue type, or body part that has been initially affected. The treatment has been to remove the tumor and/or use drugs or radiation that kill all rapidly dividing cells. Today, there's the classification and treatment that is based on the mutations in the cancer cells. This is particularly important when you are looking at ways to attack the cancer in mutations in cancers that are quite rare and that there is no or little research available and no specific treatments. Erdheim-Chester disease is a rare type of slow-growing blood cancer. It's referred to as a histiocytic neoplasm, which results in overproduction of cells called histiocytes, which normally function to destroy foreign substances and protect the body from infection. In this disease, the excess production of the histiocytes, which is called histiocytosis, leads to inflammation that can damage organs and tissues throughout the body, causing them to become thickened, dense, and scarred. Scarring is referred to as fibrotic. This tissue damage may lead to organ failure. Now, how does an individual get this disorder? Well, it arises from a somatic mutation in the histiocytes, or the precursor cells, during an individual's lifetime. We do not know if it can be inherited at this time. About half of the individuals that have Erdheim-Chester disease have a mutation V600 in a gene called BRAF. Benefiting from a targeted drug developed to treat skin cancer melanoma, which is caused by a V600 mutation, those individuals who had Erdheim-Chester disease were treated with this drug, and there was great success. Now, the National Cancer Institute's Molecular Analysis for Therapy Choice MATCH program is assigning thousands of cancer patients to receive combinations of targeted drugs tailored to the subsets of 143 well-studied mutations in their cancer cells. It takes years for cancer to produce symptoms as more and more cells lose their specializations and divide more frequently than the cells from which they descend. Mutations from single base changes to large-scale chromosomal upheavals drive the disease, accompanied by changes in gene expression, some of which are responses to environmentally induced epigenetic effects. Cancer chromosomes may be abnormal in number and or structure. They may bear translocations, inversions, or have pieces missing or extra. Translocations can hike an expression of a gene, turns it into an oncogene. Duplication increases the number of copies of an oncogene. Deletion may remove a tumor suppressor gene, and chromothripsis may kill the cell. This is a cancer chromosome shown in a chromosome spread. You can see it in the middle. In acute promyelocytic leukemia, there's a translocation between chromosomes 15 and 17. It's a combination of retinoic acid, cell surface receptor, and an oncogene, MYL. The fusion protein functions as a transcription factor. When overexpressed, it causes cancer. Some patients respond to retinoid drugs. In chronic myelogenous leukemia, CML, most patients have a translocated Philadelphia chromosome, which is a tip of 9 on 22. We talked about this before, and I know you did this in the cancer class too. The ABL chromosome 9 and the BCR chromosome 22 genes produce a fusion protein. The BCR-ABL oncoprotein is a tyrosine kinase that excessively stimulates cell division, which we always associate with cancer. Understanding cellular changes allow the development of a new drug called Gleevec for treatment. Please look at this slide to see how Gleevec works. If we see that the drug nestles into the pocket on the tyrosine kinase that must bind ATP to stimulate cell division. When ATP binding is blocked, the cancer cells do not receive the message to divide, and they cease doing so. After passing safety tests, the drug works so dramatically that it set a new speed record for drug approval. It was only 10 weeks. However, after several years of using Gleevec, resistant cancer cells may appear. Other drugs are available to continue targeted treatment for these patients. HER2 is a product of an oncogene. It stands for human epidermal growth factor receptor 2. It is found in excessive levels in approximately 25% of breast cancer patients. It promotes the growth of the cells, and tyrosine kinase receptors then send too many signals for the cells to divide. And you can use a drug called Herceptin, which is a monoclonal antibody drug, which binds to the receptors to help block the signal from the tyrosine kinase receptors so that you can stop the cells from growing. The p53 gene determines if a cell repairs DNA replication errors or it dies by apoptosis. More than 50% of human cancers involve an abnormal p53 gene. In most of your p53 related cancers, mutations occur only in somatic cells. However, in the germline condition Li-Fraumeni syndrome, family members who inherit a mutation in the p53 gene have a very high risk of developing cancer. 50% do so by the age of 30 and 90% by the age of 70. A somatic p53 mutation in the affected tissue results in cancer because a germline mutation in the gene is already present. This slide is showing you how the p53 cancers reflect environmental insults. The environment triggers mutations or changes in gene expression that lead to cancer. The p53 gene is a mediator. It's also referred to as the guardian of the genome. The protein products of many genes interact with the p53 protein, and p53 is also called TP53 or tumor protein. The two major breast cancer susceptibility genes are BRCA1 and BRCA2. BRCA1 encodes a protein that interacts with other proteins that counter DNA damage, and BRCA2 mutation increases the risk of developing colon, kidney, prostate, pancreas, gallbladder, skin, or stomach cancer. Mutations in these genes have different incidences in different populations. The BRCA1 mutations, about 1 in every 833 in the general U.S. population. It's about 1 out of 50 in the Ashkenazi Jewish population. The BRCA2 is more prevalent in the Ashkenazi Jewish population. Initially, it was discovered in Ashkenazi families in which several members developed breast cancer at a very young age. A woman who is BRCA1 positive has up to an 80% risk of developing breast cancer over her lifetime and a 40% risk of developing ovarian cancer. This slide is showing you how the BRCA1 gene controls many cellular defense mechanisms. It functions as a genetic crossroads in handling DNA damage. Inheriting a BRCA1 mutation increases susceptibility to cancers of the breast, ovary, cervix, uterine tube, uterus, peritoneum, pancreas, and prostate gland. Mutations in any of the genes in which BRCA1 interacts increases cancer susceptibility too. In 1990, Dr. Mary Claire King was able to show that a single gene on chromosome 17, later to be called the BRCA1 gene, was responsible for breast cancer. Her contribution has been able to inform women of genetic information which can then aid women in making choices for themselves and the future. If one receives a positive result for BRCA1, the risk can range from 50 to 80% for breast cancer for lifetime risk and 24 to 40% for ovarian cancer. For males, for male breast cancer, it's only about 1 to 2% for the BRCA1, but the general population is about 0.1%. Some individuals will have their breasts and ovaries removed. Women born after 1940 with a BRCA1 mutation have a higher risk than those earlier, suggesting that the environment also plays a role in whether you will inherit a mutation that causes cancer. If we look at BRCA2, we see that it's much more common among Ashkenazi women. We also see that for the lifetime risk, if you are BRCA2 positive, you have a 40 to 70% chance of developing breast cancer. You have an 11 to 18% chance of developing ovarian cancer, and in males, they have a 5 to 10% chance of developing breast cancer. Also remember that BRCA2 can increase the risk of developing cancers of the colon, the kidney, prostate, pancreas, gallbladder, skin, and stomach. Environmental factors contribute to cancer by mutating or altering the expression of genes that control the cell cycle, apoptosis, and DNA repair. Inheriting a susceptibility gene places a person further along the road to cancer. However, cancer can happen in somatic cells in anyone. Interactions between genes and the environment exist. Environmental factors contribute to cancer by mutating genes and altering gene expression.